I'm really excited to present the results of our study entitled Impact of Frailty on Surgical Outcomes of Patients with Cushing Disease using the Multicenter Rapid Registry. My name is Michael Carsey. I'm an assistant professor of neurosurgery at Drexel University. Now, RAPID is a multi-center national registry looking at pituitary tumors as well as other skull-based pathologies, and one of the first of its kind to be able to coordinate this across so many centers, and currently is at 16 sites and is continuing to grow. These are the disclosures for this particular study. Cushing's disease is a rare disease with approximately 1 to 2 cases per million, and one with increased mortality that is noted in patients with hypercortisolemia. But due to this rarity, it is a difficult disease to study and manage. Frailty is a recent concept in medicine as well as neurosurgery, and there are increasing number of studies showing that increased frailty indices correlate with worsened outcomes, including pituitary adenomas. However, due to the rarity of Cushing's disease, frailty has not been specifically studied in this disease group. We sought to explore the rapid registry data from 2011 to 2023, which included retrospective and prospective data. 6 centers data were included. We used the 11-factor frailty index and divided it into 3 categories. And the primary outcomes were looking at length of stay, disposition, and complications. The distribution of patients is shown here with increasing age in patients with frailty, no differences in surgical characteristics. There was an increase in preoperative A1C level, which was notable in frail patients, and we'll discuss that later. In terms of outcomes, we found increased length of stay with frailty, increased likelihood of disposition to a nursing facility or rehab with frailty, as well as increased likelihood of venous thromboembolism with frailty, but did not see other complications that were associated with it. We didn't see worsened 90-day readmission or disease remission with frailty. We used multivariate analysis to further confirm these findings and found that length of stay did correlate with frailty. We also showed that disposition to nursing facility or rehab worsened with frailty and after controlling for other factors. This data showed that preoperative A1C level and length of stay were correlated, which is interesting in that this could be a potentially modifiable risk factor for these patients. And if it remains to be seen if improving A1C level might be able to improve outcomes for this group of patients prior to surgery. In conclusion, frailty was associated with increased length of stay, discharge to nursing facility or rehab, and complications such as venous thromboembolism. This may offer the potential to better screen patients for venous thromboembolism, which is an area of controversy with Cushing's disease and one that is an active area of research with our group as well. A1C was found to be higher in frail populations, and this could be potentially modifiable. It remains to be seen if that's the case. There are limitations with the study that included some prospective data, but the vast majority of data was actually retrospective. And there was an uneven distribution of frailty scores at the different sites, as well as a lack of the higher frailty numbers. So overall, a lot of these findings are showing increased risk with even mild frail numbers, but it remains to be seen what's happening at the higher frail numbers as well. And there was limited laboratory data. Each center was a center of excellence where we each used individual levels to determine hypercortisolemia as well as remission. There was no uniform protocol for all the different groups. We would like to acknowledge and thank the various principal investigators and study coordinators at each of the sites, as well as the Barrow Clinical Outcomes Center. Thank you very much for your attention.